Hello, good morning everyone. My name is Chen Hao Fan. Today we start talk about USMLE examination step 2 clinical knowledge. We start from internal medicine section of cardiology. 同学们大家好，今天我们开始讲美国医生执照考试第二步的临床知识部分。我们从内科的心脏部分讲起。The characteristics of the step 2 CK. Most questions are diagnostic, some on treatment and pathophysiology. There are overlaps and differences with step 1 and step 3. Step 1 mainly talk about pathophysiology, while step 3 mainly talk about treatment. So step 3 is not required for match. However, it is beneficial for international students to get a position if you pass that. Now, we start talk about the topics congenital heart disease. In this talk, most time I prefer to use English directly. Only in some points I will translate in Chinese to make sure you already have understood it. You may not satisfy completely with my English, with accent. However, I'm a Chinese as you guys do. I'm happy with that, and I emphasize that you keep practicing because in future, what you need to deal with is American patients. You need to make sure you understand what I'm talking about because they speak pretty fast, and also make sure yourself understood by them. Okay, we start read. I just read these slides prepared by Hongjing School, and I merely emphasize some important points. I don't talk about everything, and many other things you can reference the English books like Harrison's Principles of the Internal Medicine. Washington University published the Internal Medicine Manual, or some pocket book published by Harvard Medical School. Okay, I just read through these slides, and if some points I may explain that. Overview: there are three main categories of congenital heart disease: conditions causing a right to left shunt, conditions causing a left to right shunt, and conditions causing obstructions. Okay, 总共有3类。In the right to left shunt, the oxygenated blood from the right side of the heart goes to the left side. Thus, the oxygenated blood is delivered to the body. This type of shunt usually results in cyanosis, 导致自干 at the time of birth. A left to right shunt increases the amount of blood delivered to the right side of the heart and will result in hypertrophy and the dilation of the right atrium and right ventricle, or both, depending upon the type of shunt. Eventually, the pressure in the right side of the heart increases and surpasses that in the left side of the heart, resulting in reversal of the shunt from left to right to a right to left shunt. This change is called Eisenmenger syndrome. With obstruction, an abnormally formed valve or vessel leads to pressure overload of the involved atrium or ventricle. So here's a picture of that. So you can see we generally classify 2 types, and in a cyanotic part we can see there are left to right shunts and outflow obstruction. Here, left to right shunts include ventricular septal defect, VSD, persistent ductus arteriosus, patent ductus arteriosus, atrial septal defect, ASD. Outflow obstruction includes pulmonary stenosis, aortic stenosis, coarctation of aorta. Here there are some points: difference stenosis and coarctation. We talk about the stenosis mainly refer to the narrow of valves and the surrounding structures. Here, coarctation means the narrow of the chamber of aorta. In cyanotic part, we mainly talk about tetraphala, transposition of the great artery. So we mention some other disorders. Right to left shunt, causes of right to left shunt, tetralogy of phala, morphology of tetraphala, pulmonary stenosis. Okay, the valve may be narrow, or the right ventricle may hypertrophy. Here, that's caused outflow tract obstruction. A ventricular septal defect shunts blood to the left side of the heart, or because of high pressure in the right side, so the blood shunts to the left side, causes cyanosis. The aorta overrides the ventricular septal defect. So the aorta part, because shift to the right and overrides the ventricular septal defect. Important point, tetraphala is the most common cause of right to left shunt in newborn. Here are some pictures. So this is a normal heart. Here we can see there's a narrow chamber around the tricuspid valve that causes stenosis of pulmonary artery, and the ventricular hypertrophy, and the VSD, and the override of aorta. Okay, here also you can see the 4 factors forms tetraphala. It's the same pictures, I don't explain more. Complications of tetraphala, like erythrocytosis, 红细胞增多, paradoxical emboli through ventricular septal defect. We talk about the venous emboli formed in like deep venous thrombosis and cause PE, pulmonary embolism. However, because of ventricular septal defect, the emboli can flow through to the left side and then pump out from left ventricular and go to the systolic system and cause stroke, endocarditis, and ventricular arrhythmias. Clinical presentation of tetraphala, cyanosis, and failure to thrive. 身高变矮了. Patients squat to alleviate symptoms by increasing venous return. Oh, here are some points. So actually, the squat causes the high resistance, systemic resistance. So they may raise the pressure at the left side. So then reduce the shunt from right to left side. That's the mechanism. The classic pattern seen on chest radiograph is a boot-shaped heart. Patients often have paroxysm of cyanosis called TED fits, associated with the states of increased cardiac output that increase right to left shunt, such as crying, exercise, and hot bath, feeding. 它是有一些子宫的发作啊，在哭泣啊、运动啊，或者是吃饭的时候啊，你可以 you can find some skin change the color, blue baby, and ashen. The lips, okay, change the color, or nail beds change the color. Okay, tetraphala, although crippling, often allows children to growing up into infancy. It is also the most common cyanotic anomaly, and thus any exam question in which a 5 or 6-year-old is cyanotic is bound to be tetralogic. The children are small for the age, have a bluish hue in the lips and the tips of the fingers, clubbing and spells of cyanosis relieved by squatting. Okay, here we mention clubbing, 触状词. The mechanism currently we don't Actually, no, and some propose because of hypoxia, and that causes local hormone relief, and that promote the connective tissue overgrowth. Some may say there is a factor like platelet-derived growth factor release, and cause the connective tissue overgrowth. Also, maybe neuron mechanism involves that. So I just get some impression.